2025 is just around the corner, and with it comes the need for healthcare organizations to meet ever-evolving accreditation and compliance standards. Today, we'll explore a comprehensive checklist for managers to streamline the process, ensure readiness, and navigate the complexities of audits and compliance checks. Welcome to the HIVLLC channel. If you're a health or program leader working to improve health outcomes and tackle health disparities, this channel is for you. Our mission is to empower leaders like you by providing interdisciplinary insights and actionable strategies that benefit vulnerable and minority populations. Preparing for accreditation and compliance in 2025, a manager's checklist. Preparation begins with understanding the standards and requirements. Accreditation agencies like the Joint Commission, DNV, HFAP, and HRSA for health centers update their guidelines regularly. Staying informed is your first step.
Start by reviewing the latest updates from your accrediting body. Many organizations provide newsletters, webinars, and resource libraries to help you stay current. It's crucial to align your policies with these standards early.
For health centers, HRSA accreditation emphasizes compliance with the health center program's 19 program requirements. Familiarize yourself with their compliance manual and site visit protocol as a starting point. Create a detailed checklist tailored to your specific accreditation body. Include sections for patient safety, infection control, data security, HRS's program requirements, and documentation protocols. Pro tip: use digital tools like accreditation management software and HRSA's site visit toolkits to centralize and track requirements. A critical step in preparation is learning from the past. Reviewing your last accreditation process provides valuable insights into what worked well and what didn't.
During our last HRSA site visit, we excelled in areas like patient engagement and governance compliance. However, documentation around quality improvement needed corrections. Since then, we've implemented new protocols to ensure all quality initiatives are thoroughly recorded and tracked.
Identify areas where corrections were required and evaluate whether those gaps have been addressed effectively. Have there been updates to policies, staff training, or systems to prevent recurring issues? Documenting these improvements not only ensures readiness, but also demonstrates your organization's commitment to continuous improvement. Pro tip: compare your current state against past feedback to highlight growth and readiness. A gap analysis is a critical tool for identifying areas that need improvement. It's a structured way to compare your current processes against required standards.
We conducted a thorough gap analysis 6 months before our last audit. It highlighted weak spots we hadn't considered, allowing us to address them proactively.
Engage your team in this process. Frontline staff often have valuable insights into areas where compliance might falter. Tools like SWOT analysis can also provide a comprehensive view. Remember, the sooner you identify gaps, the more time you have to implement corrective actions. Accreditation audits thrive on documentation. If it's not documented, it didn't happen. Ensuring meticulous record keeping is a non-negotiable.
We invested in electronic health record systems that integrated compliance tracking. It streamlined our audits and reduced errors significantly.
For HRSA accreditation, ensure that documentation reflects compliance with the 19 program requirements, including needs assessments, quality improvement plans, and governance bylaws. Pro tip: regularly audit your own records to ensure accuracy and completeness. Use HRSA's self-assessment tool for guidance. Section 5. Training and engaging your team. Your team plays a pivotal role in compliance. Ensuring they understand their responsibilities and the importance of accreditation standards is key. Use interactive methods like role-playing and scenario-based learning to make training engaging and practical.
We introduced monthly compliance drills and quizzes. It's a simple way to keep the team's knowledge sharp and identify areas where additional training is needed.
For health centers seeking HRSA accreditation, training should also cover the specific operational and governance requirements outlined in the compliance manual. Pro tip: recognize and reward compliance champions within your team to boost morale and engagement. Mock audits are your dress rehearsal. They simulate the accreditation process and identify potential issues before the real audit.
Our mock audits included external consultants who brought fresh perspectives. They pointed out compliance risks we had overlooked.
Debrief after each mock audit. Document findings, assign responsibilities, and track progress on corrective actions. Use HRSA's site visit protocol to simulate their evaluation criteria. Pro tip: schedule multiple mock audits to address evolving standards and ensure ongoing readiness. Section 7. Leveraging technology and resources. Technology can be a game changer in compliance management. Tools like accreditation management software, electronic health record systems, and compliance dashboards simplify tracking and reporting. Additionally, leverage resources from professional organizations. Many offer compliance checklists, webinars, and expert consultations to support your efforts.
We subscribed to a compliance resource hub that provided templates and policy updates. It saved us countless hours.
Pro tip: automate reminders for accreditation deadlines to stay ahead of the curve. Preparing for accreditation and compliance in 2025 doesn't have to be overwhelming. With a clear plan, the right tools, and an engaged team, you can navigate the process with confidence. You are making meaningful change,